The 3D Technologies program here at BC Children's Hospital is truly cutting edge and the envy of the world.
The 3D Technologies program is about taking medical imaging data or other kinds of data and turning it into digital objects that we can do a lot of different things with. That means surgical planning, where we can look at different approaches and we can create a physical object. And that object might be their patient's own anatomy, like their heart or their bone. Or sometimes we're creating little jigs that we use in conjunction with surgery to make that surgery more efficient.
We are here today in the 3D printing room, which is the heart of the 3D Technologies program at BC Children's Hospital. Because we are housed within the hospital, to be able to talk to clinicians from different clinical departments and divisions, and then that enables the cross-pollination of ideas, people seeing the work that we do, people talk to one another about it, they want to implement it within their departments as well.
So when we were just getting started, I would say we were doing early work from an R&D perspective in 3D printing, the capabilities of it. We were printing models. What Kermac and the support of the community, what we're able to do is to really accelerate that. And it was like rocket fuel that helped the amount of volume, the complexity of cases, the technology we're able to use. It changed everything.
The partnership that we have with the Digital Lab has been something which has grown immensely over the years. It's now become an integral part of clinical care. When I see a patient in clinic, I'm immediately thinking, will they benefit from this technology? And what it's done is it's allowed me to approach more and more difficult cases with much more confidence. And in fact, some cases that we wouldn't have been able to do before, we can now do because of this 3D technology.
We get to not only test and collaborate with the surgeons right at the very beginning of coming up with an idea, but also the fact that we can simulate the surgeries. A lot of the decision-making that happens in the operating room is brought into the preoperative phase.
I had one particular case of a young boy with spinal epiphyseodysplasia. Zach is an incredible little boy. His bones were tiny and his hips were underdeveloped. Prior to the surgery, he really struggled to walk. So we were able to partner with the Digital Lab. When we went into the surgery, we knew exactly where to place the screws and where to make the cuts so that we were confident that we would be able to fit his implant into his bone. There was no room for error. This had to be millimeter perfect. And with the cutting jigs that we used from the Digital Lab, we were able to achieve this. And he's now able to run around and play with his siblings.
The program has grown tremendously since when we started, and we're really just at the cusp of what's possible.
Well, I would like Kermac Cares for Kids to know what a difference they're making to the lives of children here in BC. It's really revolutionized the way that we deliver surgical care, and it's put us at the forefront of the technology in the world.
At the core of this work is the patients and families. At the end of the day, this is what we're here for, and this is what drives us.
Thank you to Kermac Cares for Kids for making the 3D Technologies program possible.
Thank you for your partnership and for everything that you've done to help us transform tomorrow.